Hello, Mr. Foster. Tricia with Respiratory Care. How are you doing today? Good. It sounds like you're going to be getting to go home tomorrow. So I'm here. Doctor's changed your medication a little bit, and he's added some he wants you to start taking once you're home on a daily basis. So if it's okay, we'll go over that medication here. Can I get your name and date of birth, please? Okay. Mind if I have a seat here? That way we can go over some of these medications and the changes he'll be having you do. So it looks like you were doing the DuoNeb, and that was the one you were inhaling every day with that little tube. That is your, what we call the bronchodilator. So that one's going to relax the smooth muscle within your lungs and get you breathing better when you're wheezing, you're short of breath, those types of things that will kind of have a quick onset, about 15 minutes or so, but that one's only designed to last about 12 hours or so. So we'll do this one twice a day. Let me get this here for you. Like I said, this is the one where we put into this little medicine cup here, and then you'll do this twice a day, just morning and night at home. So first I'm gonna get a few vital signs from you, just like we did when we were doing the DuoNeb. Get your lung sounds here. Big breath in now for me. Good. Very good. Good. Maybe sit up for me a little bit. I'll listen behind. Very good. Big breath. Good. And sit up. Very good. All right, and then I'm just going to get your pulse real quick here. Very good. And then put a little device on your finger to get your oxygen level in your blood. All right, so we are going to start with this medication here. Like I said, as you've watched me and I've kind of explained, let's just twist off and we put that medication right into the little cup here for you. Then we hook this little piece right here into your machine that you're going to get from the pharmacy. So we turn the on button. So let's go ahead and do that. Switch on the oxygen here. And with this, you take normal breaths, big deep breaths every couple of breaths, every 2-3 breaths, try and take a big deep breath for me. This will take about 10 minutes or so to complete of this one. All right, very good. Now I'm going to have you take a big deep breath in and cough for me. Very good. And then I'm going to go ahead and take a listen to your vital signs again. Go ahead and get that pulse rate. Good. Sometimes this will raise the pulse a little bit. So sometimes you'll have a little bit of increased heart rate, or you'll kind of feel jittery or tremory a little bit, and that's normal. If it gets too bothersome, though, we do want you to report that. Or if any other abnormal things come up after taking this medication we definitely want you to report that. Give your clinic a call and maybe talk to the nurse and let her know what's going on with that. So I'm going to take a listen to your lungs here. Back first. Go ahead and take a big deep breath for me. Good. Other side. Good. Good big breaths. Very good. So just a reminder, like I said, that one was what we call Brovana. It'll replace the DuoNeb. That is going to open up those airways when you're wheezing, feeling short of breath. We'll do that 2 times a day. It only has that 12-hour time frame, so that's why we're going to do it 2 times a day. So then the other thing the doctor would like you to add to this, the next thing is what we call, this is a little, the first one we did was called what we call small volume nebulizer. The second one is called a Respimat. This is a small mist inhaler. So we've got an inhaler, but it's used with a mist. So there'd typically be a little canister comes with it. Push that up into here. And then we have another little device here. We're going to put this on the bottom. Here it's snap. And then your medication is in there. And we have a little counter here on the side. Let you know when your medicine's getting short and you need to reorder that. So now with this one has, again, kind of a short onset, about 10-15 minutes. It's going to start to help, again, open up those airways for you so you can breathe a little easier. This one also has 12-hour duration, but this one we're just going to do daily. So the first one that we did, that one, immediate action, going to help you. This one will kind of prevent. So your first one that you're using, that one is going to kind of reverse that tightness in your chest. This one is going to prevent that, or try to prevent that from happening as much as it does. So with this particular one, we're just going to use this once a day. With this one, like I said, you put that canister in. Once you go to use it, you're going to twist this. Hear that click? Open up the lid here. And I want you to take a breath out and get all the air out that you can of your lungs. And then when you breathe in, we're going to put your mouth tight around here and seal your mouth around this, and push this little button here on the outside. I'll just show you kind of a dose first here. Push on that while you're breathing in nice and deep, and that mist is going to go right into the lungs. Once you've taken a deep breath in, hold your breath for 10 seconds. Then I want you to take this away from your mouth and breathe back out. Okay, we just don't want to breathe back into the inhaler piece of it. So, okay, are you ready for this one? All right, so again, we hear that click. Breath out, get all that air out of your lungs. Seal around. Big deep breath in. Hold it for 10 seconds. And then breathe out for me. Very good. So like I said, this one is going to kind of prevent some of that tightness, chest wheezing that you're getting. Over long-term use, that's going to help better and better as a preventative measure. So like I said, this one is called Spiriva. I told you before it was the Respimat. This is Spiriva Respimat. That's the name of this drug. The third thing we're going to do is going to add another thing yet. This over long-term. This is going to help with the inflammation because your lungs are inflamed because it's a chronic issue with that bronchoconstriction or that tightness in your lungs. So the inflammation that we want to target with this medication, it'll reduce that inflammation over time. So again, it's going to help you over time. It's not a rescue. We don't use it if you're having wheezing or shortness of breath. It's not going to fix it right away per se. So this one is what we call a metered dose inhaler. So we have a little canister of medication, a little boot that we put that into, and you just slide it right up into there, and then you'll have a counter on the back side here that tells you how many doses you're using. So make sure that that's nice and pressed in there. One thing we'll do with this is we'll shake it really good because if there's medications in here, we want to mix all that together so it works right for you. And then when you first get one of these, every time you fill this at the pharmacy, we want you to do a release dose. So you just press it and you see that medication come out there. If for some reason you haven't been using this for a day or two, a couple days it's been laying around for some reason, do that first dose before you actually inhale a dose yourself. They all have these little mouthpieces on here. With this particular one, this is Qvar. That's the name of this medication. Again, it's a metered dose inhaler. Every dose will be counted for you as you use it. With this particular one, again, steroids going to target the inflammation. This little device is a spacer. So we're going to take this mouthpiece off. We're going to put that into the spacer because we want you to use this to get the best benefit out of the medication. Sometimes when we press on this and then we have you breathe in nice and deep, you might have a delay or things like that. So we want you to press this in. That medication will stay in here. Take a big deep breath in. It's going to get all that medication in the lungs where it needs to go. So with this one, we press down, take a big breath in. Again, we're going to hold your breath for 10 seconds, and then we're going to breathe out away from this particular inhaler. With this one can cause like a thrush in the mouth for buildup. So we're going to have you rinse your mouth and gargle that out afterwards. We always want you to do that. So we'll take this little mouthpiece off here. And again, we'll have you seal your mouth tight around here. So I want you to take all the air out of your lungs. Seal and take a big breath in as I'm pressing this down. Very good. In, hold for 10 seconds. Away from the device. Go ahead and breathe out for me. Very good. So like I said, again, this is that Qvar. This will reduce the inflammation. This one, we're going to rinse your mouth out. I'll give you a little bit of water. Rinse it around, spit it back out in that cup. Very good. We want to do that every time because like I said, it can build up in the mouth, cause a thrush for you. Sometimes the other things for this, be a little bit of dry mouth, give you a cough. If those get bothersome, again, we want you to report that to the clinic. One of the nurses there, let them know. We don't want you getting too uncomfortable with some of those side effects. So, all right, I'm going to take a listen to your lungs again after we did all of those and see how we're doing. I'll start in the back first. I'll be lean forward for me. Very good. Take deep breaths for me. Good. Take deep breaths. Good. And get your pulse rate again. Very good. And then we'll check your oxygen level on your blood. and that's looking good too. Okay, so just kind of a real quick general overview. We've got that Brovana that's going to target you right away, get those airways open with your wheezing, short of breath, kind of immediate action that lasts about 12 hours. Tremors, increased heart rate can be some of those things, but if, again, they get too bothersome, feeling like you're sick to your stomach every time, anything else develops, be sure and let us know. The next one will be that Spiriva, that mist inhaler that you do. That one is going to prevent that tightness in your chest and that bronchoconstriction within the lungs. With that one, there again, dry mouth and cough. If that gets to be too bothersome, go ahead and give us a call and let us know. Call your clinic, let them know. And then the Q-Bar, and that is the preventative long-term for the inflammation, or reduces that inflammation as you use it long-term. Again, cough, dry mouth. Make sure you shake it good before you're using it, or if it sits for a few days, and rinse in your mouth afterwards. If for some reason you would start to see a change in your voice, you're going to get hoarseness, like I said, change in that voice, let us know, because we may do some change in the medications too. So do you have any questions for me today? Okay, well, Mr. Foster, I really appreciate you letting me go through this medication with you. Hopefully it wasn't too much at one time, but be sure and give us a call if you have any questions at all at any time. So it was very nice working with you. Thank you, Mr. Foster.